Hello, ladies and gentlemen, and thank you so much for listening to me in this series of Brain Talk. We have talked before about the safe entry zone in the brainstem, and we talked firstly about the safe entry zone of the midbrain. And this time we will talk about, the safe entry zone of the Pons. So starting here, this is, an image of the brainstem here. Here's the midbrain, here's the pons, and here's the medulla. So the first, safe entry zone in the pons is called the peritrigeminal zone. And the peritrigeminal zone, it means around the trigeminal nerve. So there is here a superior safe entry zone over the trigeminal nerve, and also we have inferior trigeminal zone for ventral lesions in the pons. Here another picture. We see here the trigeminal nerve, and here is the facial and vestibulocochlear nerve. And between those nerves, there is called a peritrigeminal safe entry zone for ventral lesions in the pons. Here another axial, image shows the trajectory of the pretrigeminal safe entry zone. Anteriorly, we can, have the cortical spinal tract during our resection of the lesion, and posteriorly we have the motor sensory and nuclei of the trigeminal nerve. Another picture from brainstem, atlas of the brainstem. We have here, this is the trigeminal nerve. Here is the complex of the facial nerve and the vestibulocochlear nerve. And between them, we can do an incision for the safe entry zone. It's called the peritrigeminal safe entry zone. Posteriorly, we will, have the nuclei of the trigeminal nerve, also the nucleus of the abducens nerve inferiorly, posteriorly. Anteriorly, you will have the corticospinal tract during our dissection for lesions in the in this entry zone. Here another safe entry zone is called the supratrigeminal safe entry zone, which actually between the pontine and mesencephalic sulcus and the trigeminal nerve. We can use the retrosigmoid approach for reaching, the peritrigeminal zone. We have here the trigeminal nerve here, and around it we can hear this is the facial nerve here, and between them we will, doing our incision in this area. Another, approach for the pretrigeminal zone, safe entry zone, is called the Kawase approach, which use to expose the exposure of the peritrigeminal entry zone of the pons. The trigeminal nerve is here, and here is the facial nerve. Between them, our incision will be made for peritrigeminal safe entry zone. Here, the operation incision will be between the two nerves here, between the trigeminal and between the facial nerve. So structure, at risk during our, incision in the pons during these using this approach or using this safe entry zone. Firstly, we have abducens nerve and facial nerve inferiorly, and also the trigeminal nerve superiorly, whereas there is trigeminal spinal tract and the trigeminal motor and sensory nuclei will be, in the posterior medial side. Lastly, we will have or counter the corticospinal tract in the anterior medial side. So here, this is the abducens nerve, here the facial nerve, and inferiorly, and here is this called the intrapontine segment of trigeminal nerve in superior side, and is the trigeminal spinal tract. Here is called the trigeminal and main sensory nuclei in the posterior medial side of our insertion in the safe entry zone. And here, lastly, is the corticospinal tract will be interior and medial side of the pre-trigeminal safe entry zone. Another, safe entry zone in the brain, in the pons, is called the supra and infrafacial collicular safe entry zone for dorsal pontine lesion. So here is the posterior side of the pons, also called the floor of the fourth ventricle. Here, the safe entry zone. First, we have superficial collicular safe entry zone. Here is the facial colliculus, and here, below it, it will be the intrafacial collicular safe entry zone. The median suboccipital approach, it will be the suitable approach for reaching the floor of the fourth ventricle. Here is the fourth ventricle. We just only retract the tonsils and vermis superiorly to find the floor of fourth ventricle. The most important structure here to evaluate is the facial colliculus on both sides. So there is like 37% of patient, the facial colliculi cannot be clear anatomy, or it will not have a prominence in the floor of the fourth ventricle. That means it will be difficult sometimes to distinct these facial colliculi. So the facial colliculus is also here is important landmark of the fourth ventricle. The facial colliculus is formed by this abducens nerve nucleus and intrapontine segment of the facial nerve. Here is the abducens nucleus here, and here is the intrapontine segment of the facial nerve. Here, the intrapontine segment of the facial nerve arises from the facial nucleus and goes back to reach the floor. After that, it curves around the abducens nucleus and then runs forward to exist, the brainstem here. So at the same time, seeing that the intrapontine segment of the abducens nerve arises also from the abducens nucleus and runs forward to exist the brainstem here. Here is called the superior fovea and has a triangular shape. It's in the superior lateral edge, it will be formed by the cerebellum superior, cerebellum mid ankle, and inferior lateral to the fovea, it will be the vestibular area here. And in medial base of this triangular, it will be the sulcus limigens here. So the lateral, base of the, superior fovea triangle is very important, landmarks for the upper edge of the facial colliculus in case these, facial prominence cannot be seen. So the sublateral base of this, fovea, it will be a good mark, to localize where is the facial colliculus here. Here is the trigeminal motor nucleus located deep in the superior lateral edge of this triangle. Here, the dorsal pontine lesions, the entry zone will be above and below the facial colliculus. The superior, superficial, approach is bordered superiorly by the frenulum villi, is containing the auricular nerve, and inferiorly by the facial nerve. So here will be the safe entry zone to enter to the pons. And medially here will be this medial longitudinal fasciculus, and laterally it will be the sulcus limitans here. Sulcus limitans, is just only positioned just medial to the trigeminal nucleus, also trigeminal mesencephalic and central tegmental tracts. Here is the trigeminal mesencephalic tract, and here is the central tegmental tracts. The infrafacial approach is bordered, superiorly by the facial, colliculus, and the hypoglossal triangle inferiorly. So here it will be another safe entry zone for entering the pons. Medial longitudinal fasciculus, it will be medially, and the facial nucleus together with the nucleus ambiguous, which are the same coronal plane laterally. The rostocaudal length of infrafacial entry zone is the same as the distance between the upper and lower border of the lateral braces. Here, a very important another safe entry zone in the pons, and it's called the median sulcus of the fourth ventricle. It's in the midline here. So any lesions in the midline, we can go through the midline or the median sulcus of the fourth ventricles to reach these lesions. By this last slides, we reach the last lecture of the safe entry zone of the brainstem, the pons. Next lecture will be the safe entry zone of the medulla. See you next time, and goodbye for you all.